Hi everyone, my name is Michelle Boakye. I'm a fourth year PhD nursing student at Penn State College of Nursing. I'm going to present on a paper titled What Individuals Want to Hear at the Point of Type 2 Diabetes Diagnosis. I worked on this study with Dr. Sheridan Miyamoto, a faculty member also at Penn State College of Nursing, and with Dr. Deborah Greenwood at College of Nursing, UT Health, San Antonio, Texas. So type 2 diabetes is the most common form of diabetes, and it accounts for approximately 90 to 95% of all diabetes cases. Like many chronic conditions, the point of type 2 diabetes diagnosis is a stressful life moment for many adults as they become aware of a critical change in their health status. In order not to overwhelm them, there's a need to find ways to engage people so that they are psychologically prepared to actively participate in diabetes management. Therefore, the purpose of our study was to examine the experiences of individuals at the time of type 2 diabetes diagnosis, and also to explore individuals' perceptions of important information they wanted on the day of diagnosis or shortly thereafter. To achieve our goals, we conducted a qualitative study and sampled our participants from Research March. The inclusion criteria for the study were adults diagnosed with type 2 diabetes within the past 12 months and those who had already received formal diabetes education. The study data were collected through semi-structured individual interviews conducted via Zoom. All the interviews were audio recorded and transcribed. The transcripts were uploaded into MassQDA to facilitate coding and analysis using an inductive thematic approach. In all, 18 people participated in this study, and the majority of the participants were 45 years old and beyond and were highly educated. Two qualitative themes emerged after the analysis. One, emotional surge at point of type 2 diabetes diagnosis inhibits action. Under this theme, participants shared that they experienced strong emotions such as shock, disappointment, denial, and others said they were heartbroken when they received the diagnosis of type 2 diabetes. The reason they gave for their reaction was because they did not perceive themselves as susceptible to type 2 diabetes. Many of the participants share that these and other emotions left them feeling helpless, and they were not able to articulate their concerns, thoughts, or even engage in the diagnosis conversation with their healthcare providers. With theme 2, when participants were asked what could have made their experience at diagnosis better, many shared that they wanted reassurance and a follow-up plan from their healthcare providers. This led to 3 sub-themes representing the core messages individuals wanted to hear at diagnosis. First of all, the study participants want healthcare providers to tell anyone at type 2 diabetes diagnosis appointment that type 2 diabetes is manageable. They believe that this message can help people overcome the strong emotions they experience at diagnosis, and also reassure them that even with type 2 diabetes, they could still have a healthy life. Because many of the study participants were overly concerned about how they were going to self-manage the condition, they were of the view that healthcare providers should reassure people of learning opportunities and support systems which are available to help them adjust to the diagnosis. They believe that this message could also comfort people and let them know that they will not be alone in the management of the diabetes. Lastly, participants were of the view that healthcare providers should reassure them of follow-up visit that will be scheduled to discuss their next action, because many of them left the consulting rooms feeling confused and not able to really express how they felt about the condition or not knowing what they were supposed to do. In conclusion, this study found that emotional reactions at diagnosis affect the ability to act and process information at type 2 diabetes diagnosis. Therefore, healthcare providers should be empathetic and use therapeutic communication skills at type 2 diabetes diagnosis. Also, key diabetes information should be provided at diagnosis, and the diabetes diagnosis appointment should be used as a reassuring moment and a time for creating partnership with the individual. Thank you for your attention.